Assalamualaikum warahmatullahi. Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good evening to all members. Selamat tengah hari. Terima kasih kerana bersama semua dengan kita. Thank you very much for joining us. And as you can see that today I am from what we call the Malaysian Society of Oral Microbiologists and Oral Microimmunologists. I'm Dr. Muhammad Hafiz from International Islamic University, Malaysia. Will be the moderator for our forum today, and then this forum is very, very important. Upon discussion with other members, we found out that currently the situation where some people are taking vaccine, some people are refusing, and then there are lots of misconception. Because of that reason, my respected colleagues together with us today, Prof. Maha binti Abdullah. Okay, allow me to read a little bit of the CV of Prof. Maha. She is a very respected scientist that we have. She is currently the professor at the Department of Pathology, Faculty of Medicine and Science at the University Putra Malaysia. She was graduated from University Putra Malaysia in the area of immunology, masters from University of Malaya in the area of immunology and molecular biology, and UKM during the BSc in the area of microbiology. She has been publishing a lot of journal articles, including less utilized diagnostic markers in acute myeloid leukemia and many, many more. I don't want to explain so much about Prof. Maha because everyone already know her. But the reason why we bring Prof. Maha today, because she is a well-known prolific professor in the area of microbiology and immunology, and that is very much related to the topic that we are going to discuss today on COVID-19 vaccine, separating between misconception and truth. And together with us today as well, Dr. Mahfuz. Yeah, Dr. Mahfuz is also another well-known researcher. Okay, so we have Dr. Mahfuz was graduated from King's College London during his PhD and his master, and he is also a very he did his postdoctoral in Finland, and then following that he joined University of Malaysia, Malaysia Pahang as the senior lecturer, and currently has been securing many grants, and he is also working what I call on COVID-19 as well, which I believe that this is going to be a very interesting topic for us to discuss today, particularly on the COVID-19 vaccine. I think without further much delay, Prof. Maha and Dr. Mahfuz, allow me to begin with the questions. Okay, so Prof. Maha, let me begin asking you a question. Okay, first, the fact that serious adverse reaction to immunization, or what we call as AFI to COVID-19 vaccine, Pfizer, not only Pfizer, but also others, are rare. Do you have any comments on that? Are you sure that the side effects to immunization is rare? Or do you have any other thought on that particular matter? Please, Prof. Maha.
Okay, Bismillahirrahmanirrahim. Assalamualaikum and a very good afternoon. Thank you very much, Dr. Hafiz, for the opportunity. I want to thank the organizers and Malaysian Society of Oral Microbiology and for oral microbiologists and oral immunologists, of which Dr. Hafiz is one of the vice president juga. So I am honored to be here. This is a big topic. We are in a world of confusion. So I am from University Putra Malaysia, from Department of Pathology, but I am also privileged to work at the Hospital Pengajar UPM, and we are conducting a small number of vaccination there also for our health workers. So before I answer that question, I hope you will allow me to just give a bit of introduction to this area, which is COVID-19, of course. And COVID-19 is caused by a virus, and very quickly virus classification. I thought we just need to understand a bit about the virus first before we go on to answering the question. So viruses are classified largely as DNA viruses, right? And some of these DNA viruses are the oncogenic virus that cause vascular, cervical cancers and liver cancers. The one that we are interested in is, of course, from the RNA viruses. So it's a single-stranded positive strand envelope, and here it is, coronavirus virus, the SARS group. And within these RNA viruses, there's also the poliovirus, right? The mumps, measles, influenza viruses that we are all currently vaccinated against. So vaccination is not such a new thing to us. It is a regular thing that we do to our children to protect from very serious infections. So COVID-19 is the disease, and it is caused by SARS-CoV-2. And so this is a real look at the virus, colored very nicely. Under a high power magnification, it's actually very small, a nanometer in size. So this is the cartoon of it. You have the RNA, this piece of genetic material that is where the codes that encodes the information for all the proteins that make up the virus, which include the E, you may hear about it when you, the diagnostic kits that we work with, the M protein, the nucleic, the N protein, and then of course the spike protein, which is used for vaccination purposes. So if you open up this RNA into a long length of it, you see it's broken up into what we call genes. And each of these genes encode the proteins. So you have here the S protein, the E protein, the M, the N, and a lot of other proteins. So the virus is actually made up of 24 to 27 different proteins. This is actually a very small number because compared to the number of proteins that the human has 25,000 genes, which makes a lot of proteins. So we also know that the SARS-CoV-2 is very similar to bat, the COVID virus that infects bats, 96%. That's why we think that it came from bats. And the pangolin, for a while, it was thought as the intermediate SARS-CoV-1. There's only 80% similarity. The similarity between SARS-CoV-1 and COVID-2 for the spike is actually very small. And then, of course, the other virus, the coronavirus, is the MERS. And there's only at the genetic level 55%. And this virus, the problem with this virus is that it infects us, it infects our cell. How does it do it? So this is the cell. This is the virus with the proteins on it, particularly the S protein. It will bind to this ACE2 receptor that is on our cells. Once it binds, this protein, which is also ours, will help it to enter into our cells. Once it's in, it will start decoding from the RNA to produce the proteins of the virus using the facilities in our cells to synthesize proteins. So we talked about the proteins that make up the structure, but there are a lot more proteins that help in synthesizing the protein, such as enzymes. So these will be used to make the virus with our cells, with other proteins and the synthesizing machinery of our cells. And then it will assemble, and then through exocytosis, it will be released out. So, so this is a bit of information with the virions that enter, about the time scales. The virions that enter into the cell, it takes about 10 minutes for it to enter into our cells. When it's in, there's an eclipse period of 10 hours. That's when it starts synthesizing the protein and making more of its cells. And at the end of it, about 1,000 cells can be released from each of our cells. But you know, in our body, there's a lot more cells, and we are talking about the lungs where they first enter. We have billions of these cells within our lung. And of course, at the end of infection, you will have trillions of virus out there. So I talked about the ACE2 receptor that is expressed on cells of the lung, but where the virus enter, but this receptor is also found in other organs and tissue of our body. So we know that they not only infect the lung, they can proceed to infect other parts. Like when we get diarrhea, the suspicion is because it has infected the gut, right? So again, when we start off, we get infected, and then there is the pre-symptomatic phase where the viral numbers begin to increase, and when numbers are there, we start to become sick. So what we know is we are doing swabbing all over the country, trying to detect cases. Of course, most of the swabbings are negative, but the percent that is positive, 75% are among asymptomatic, right? So there's a large percent, 25% only fall sick. And these are the number of cases. Of course, we've been looking at meters from last year, from 15 months ago. We've been looking at this. I've been looking at this website they have this in real time access to the number of cases in each of the countries. So worldwide today, there's 172 million cases identified, and our population estimated to be 7.9 billion. So it means that today or yesterday, when this data was taken, 2.2% of the population has been infected. And the number of percent of death is 2.1% of the population. And there's a large number that is serious and hospitalized. So in US, 10.3% has been infected, UK 6.6%. So luckily for us now, at this point, only 1.8% of us are infected. And our number of deaths is only 0.5% of the infected, where it is higher in other countries and overall. But if you look at the data here, 0.1% of us are now in serious critical condition. These numbers are, of course, at that data point that you are collecting. So it's not accurate, reflecting cumulative like the rest, but we appear to have a large number that is serious condition, even though our deaths are pretty low. So we talk about COVID-19, about this virus that is infecting us, but we need to also compare it with other viruses that are currently infecting us, including influenza virus, which is very difficult to control and causing a lot of death worldwide. So these are numbers from US, the CDC report between 2010 and 2020, that as time goes on, you see there are increasing number of cases of influenza, 45 million, this is annually. So if you look at US here for COVID-19, it's very close, number of infection appears to be quite close. But if you look at the number of deaths, you know, in US, it is the death for COVID-19 is 600,000, but it's only the maximum of 61. So this is like 10 times more. And the number of, but I said we can't compare with this at the moment. So what tells us is that COVID-19 is not, even though it may not be infecting more of us than influenza, but it is causing a lot of death. And the number of death can be compared to the number of infection. This is Malaysia's data, and we know that we're collecting data since early last year. And of course, end of last year, the numbers had increased and is peaking at this moment. But the number of deaths are also the same. right? As the numbers increase, the death will increase. As it go down, number. So it's a percentage, number of death is a percentage of the infection. So you want to reduce death, you need to reduce the number. And those that become hospitalized, of course, problem is they need ventilation. They have serious injury to the lungs and they need help. They need very expensive equipment and very, ICU machinery to help them with breathing. And among these serious cases, 30% leads to kidney disease and then they need dialysis. So you need, once you're infected, and when you really go on to a serious disease state, you'll be dependent on machine, and we run out of this. It's very quickly we are running out of this, and we have to choose between who lives and who died. And it's also reported that 87.4% after infection of those who are infected has one or more persistent symptoms after having recovered, right? So at least you know that you do not want to be infected. And we know those who are at risk. Men may be higher at risk. Apparently the numbers are showing. Of course, those who are older are at risk starting from 50 onwards. And those, of course, who has morbidities, diabetes, heart disease, obesity, which are our modern diseases. So that's why vaccines are important. We, like it or not, are going to be dependent on vaccination, unless obviously there are other ways of protecting ourselves, including washing your hands, masking, distancing, and whatever. But those are not things that natural human beings seems to adhere to. So that is why vaccination is important. And in Malaysia, we got Pfizer, Astra. These are the vaccines that we have proposed to bring into the country: Pfizer, AstraZeneca, Sinovac, Sinobio, and Sputnik. But we have brought the first three in. But of course, for this to be brought in, it has to pass through manufacturers who agreed to sell to us, and also our pihak berkuasa kawalan. This is the drugs enforcement. They have to approve this. So just a bit of differences. I'm sure everybody already know this. The Pfizer is an mRNA, and I already shown you what's an mRNA. AstraZeneca and others are virus vectors, and then SINOVAC is the whole virus, which is what is now active, right? So mRNA here is for the S protein, right? Unfortunately, most of them require 2 doses, and the efficacy is quite high for Pfizer. For AstraZeneca, it can go down to 62%. For Sinovac, it's 50%. But depending on the report, it can be also goes up to 90%. Right. So there are other vaccines we are already using in our world, but not of the mRNA type, which is very new to us, which is the Pfizer and the modern. But vector virus are available, Ebola, and for our livestock. And then the deactivated viruses like polio, Japanese encephalitis, and rabies, they have been used before and been around. And their safety and efficacy is known to us. So this was the question Hafiz asked me about serious adverse reaction to immunization. Right, everybody is worried about the vaccines, but we are not new to vaccines. Vaccines have always had a risk of serious adverse reaction, but they have always been rare. So I'll just show you, these are very early trials that were conducted on the Pfizer vaccine. and the amount of AEFI. So they have tested for low dose 10 microgram, 30 microgram, 100 gram, but the one that is now given to us is about the 30 microgram. And this is the local reaction for all doses, whether dose 1 or dose 2. And you see that most are mild. You do feel pain at the site of vaccination. There is redness and there is swelling, but then the percentage is very low. They are either mild or moderate. This is showing systemic events, right? Like fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, joint pain, and then those who need to take medication. For the first dose, again, the percentage are there, but they are generally small, and they are of the mild and moderate type. And in the second dose, as you can see, some severe symptoms are coming up for fatigue, for chills. The numbers are going up, but what you know is that this, and even in the examples that we've seen, they are all short-term. By 1 or 2 days, usually it comes at the end of the day, because it's not immediately after vaccination. It's when you go home and then the fever will come up, chills will come up, but it lasts only for a day or 2. And usually by the next day, everybody is back to work. So the adverse effects are actually rare. It's not that they don't happen, but they are rare. Okay, this is another report showing anaphylaxis. So this is a really severe reaction that can lead to death, right? So in the Pfizer, it's only reported about 4.7 cases per million. And for the Moderna, it's 2.5 cases per million. This is the average for earlier vaccines is 1 case per million. That's the average. And for this, there are increase, but it is still very small. So you know how severe the disease is. And the alternative for us is a vaccine. And yes, there's a risk, but the risk is very rare. Okay. This is the AstraZeneca. And I think people are concerned with the blood clots, but they are also rare. But it is reported there are 242 clotting cases and 49 deaths. But this is in 28.5 million doses of the vaccine administered, right? So this is still considered very rare, and the health authorities are monitoring. And, if you take the AstraZeneca, most cases are reported so far occurred in women under the age of 60, and most occurred within 2 weeks of the person receiving the first dose. So you must seek urgent medical attention if you have the following symptoms in the week after your injection: shortness of breath, chest pain, leg swelling, persistent abdominal pain, neurological symptoms, tiny blood spots under the skin that is beyond the site of the infection. Yes, they are there and you need to look out for them. But again, they are rare. Okay. That's all for me.
Okay. Thank you very much, Prof. Maha. A very, very clear explanation. I hope that it has actually helped us a lot, particularly on handling all these problems. Yeah. Okay. Now let us move to our second speaker. Okay, we have Dr. Mahfuz. Okay. Now we have lots and lots of people who are, you know, like having many information on what I call that, COVID-19 vaccine. They said that, I received an email. They said that I have to use ivermectin, for example, to have having lots of vitamin C instead of taking the vaccine, and many other rumors. So maybe if you can assist us or guide us, particularly on our to our audience who may not be familiarized with this immunology. Maybe you can tell us how actually to overcome or to fight this COVID-19 misinformation.
Right. Thank you very much, Dr. Hafiz, for the invitation from the society as well. So first and foremost, I would like to make a disclaimer. Although I'm not a medical doctor, but my research specialty or research focus is in the field of immunology. So I've been doing biomedical and medical research involving mainly immunology. So Hafiz asked me about tips or how we can fight COVID-19 misinformation. Here I want to give you six tips on how to fight COVID-19 misinformation. Number one, most importantly, is always get the whole story, not just the headline. So one click can help you spot the misinformation, and always read the whole story, not just the headline. Okay. Number two, a trusted source is your safest option. So does the source have a reputation for accuracy? What is their motivation and where are they located? So normally, when you want to disseminate an information, you have to know the source. It means that, let's say if you hear a video clip or a sound clip, if a person is trying to spread misinformation, he or she will not tell who exactly he or she is. Normally, when you have a trusted information, they will tell the source of the information, and they will happily, claim the ownership of the news or the information. Okay, that is the most important thing, because when you want to talk about something, people will look at the source and also the background. Number three, share the facts but not rumors. So misinformation often spreads on website to make it look about the real thing. So always try to spot all of these mistakes, and always try to share facts, not rumors. Okay. Number four, this is maybe quite challenging and tricky, but try to get the full context from credible sources. Nowadays, we receive so much messages on our social media. So what we can do is, instead of just forwarding or trying to disseminate this information, why not try to go and do some search on the internet and see whether this information or this rumors or whatever it is being reported on the mainstream or the main media. So now we know that it is true, and then it's most importantly being reported in the right context. That is another thing. If we are not sure, then hold on or stop from sharing first and ask the expert. Okay, number five, quite important as well. If we know that an inaccurate story was being shared by our family or member or friends, so inform them and say to them that this information is not correct, and the best thing to do is give them the correct information or the alternative information. And last but not least is pause before you share. So some stories may be short on facts, but use strong emotional language to evoke a strong reaction. Check for accuracy before you share. So from these 6 tips, I want to simplify it to 2 things. Firstly, most importantly, check your source. So sometimes the source of the information, we have to verify them, make sure that it's from trusted sources. And number 2 is make sure you understand the context, because it could well be that the news that you are reporting, it is put in a certain context. For instance, previously it was reported that maybe I think around 200 or 300 healthcare workers suffer from COVID infection after the vaccination. Yes, this is right, but actually the whole story is this healthcare worker, they suffer from asymptomatic infection. of COVID after vaccination, which is a huge difference compared to the symptomatic or severe COVID infection after vaccination. I think that's for me, for the starting point. Thank you, Hafiz.
All right, thank you very much, Dr. Mahfuz, for sharing some tips to overcome. I would say not to fight lah. It looks more convenient, to overcome or to at least to get the correct information. Yeah, I do agree with what Dr. Mahfuz has been sharing with us. Yeah. Okay. Anyway, let's go into more detail with Prof. Maha. Yeah, a completed vaccine does not mean you are safe from COVID-19. Yeah, I think that is a bit, like a strong justification making people not to take vaccine. So maybe Prof. Maha, can you share some thought, when people are saying that, then why should I take the vaccine if it is not going to protect me from COVID-19? Prof. Maha, what would be your advice?
Okay, thank you very much. And I want to share my slides again. Completed vaccination does not mean you are safe from COVID-19. This is not saying that it doesn't mean that it's not for everyone. It's not safe for everyone. So I'll just give you some data to explain what I'm saying here. So this is vaccines among healthcare workers, okay? And what they found was that some of these vaccinated persons do get infection. So you have healthcare workers, they were given dose 1 between days 1 to 7 among, I think, 379 that were among 379, only 140. Okay, I am a bit confused with the numbers here. The tested is 5794 for dose 1 to 2. So among these tested, there were 145 found to have a new infection, right? And after day 8 to 17 of dose 1, 125 of 7844 but found to have an infection. And as we go on, as we know, at the early stage when we are vaccinated, we are waiting for the body to react. And at this first period of time, we are not protected. So we, after a week, antibodies will rise, and that's when we only start to be protected. But in all vaccination, not 100% will be protected. There are those small percentage that are not going to be protected. The problem is we don't know who they are. The data here is to show you that very early in your first dose, many will be unprotected. If you are exposed, you might get an infection. But as we move on to dose 2 and later in the days, there are less and less infection. So yes, there is protection. Firstly, because of how the vaccine works, it will take some time for you to be fully protected. Secondly, there are individuals who do not seroconvert, meaning that they don't produce the antibodies. There are some genetic factor or the host factor that somehow they do not respond. But our problem is because we don't monitor the antibody that is in us, we do not know who they are. So yeah, I understand what Dr. Hafiz said. Why should we be vaccinated? It's not that why should we be vaccinated. We should, because the large majority of us are protected. But there is that minority that is not. So how do you? So because of that, because we don't know who they are, that's why you have to be aware, even though you're vaccinated, you may not be protected, which is why you need to have the usual masking, distancing, washing your hands, etc. You need to maintain that for a period of time until we achieve the herd immunity. Okay.
Okay. Thank you very much, Prof. Maha. I think that is very clear, okay, for many of us who, because the question that we raised today is, I think, is the most common questions when people keep asking, like one of the questions I just mentioned to Prof. Maha a little bit earlier, okay, and on top of the AFI, which Prof. Maha have also answered in the beginning of our discussion. Now we have less than 30 minutes to settle all the questions from Maha and Dr. Mahfuz. Okay, I hope we have ample of time. Yeah, Dr. Mahfuz.
Sorry, Doctor. Yeah, go ahead.
Yes. Oh, yeah. Dr. Mahfuz, so almost 100% of the patient recovered from COVID-19. Yeah, almost 100%. That is what we call a very big claim, yeah? Almost 100% recovered from COVID-19. Then why do we need to worry about COVID-19 then? Because you said here almost 100%. So why should we worry so much about this infection of SARS-CoV-2, COVID-19? Yes, please, Dr. Mahfuz.
Okay, thank you, Hafiz, for your question. So I just want to add on to the last point that Prof. Maha mentioned. Actually, the vaccines, all the vaccines so far that is approved, most importantly, it will help us to prevent symptomatic and severe COVID-19. So in Malaysia, we have 5 stages. So if I think so far from the cases that have been reported, the healthcare worker that got the vaccine after the vaccination, they only get stage 1 and stage 2. So mostly asymptomatic. So this is why we need to get vaccine. And although 95.5%, sorry, almost 100% are protected, are recovered from the COVID infection, there are various reasons why we need to get vaccine because of the long-term effect of COVID-19 infection itself. I think it could be divided into 3. Okay. Firstly is we have to bear in mind that whenever we get the COVID-19 infection, we don't know for sure that which stage we will progress or which stage we will recover. That's the most important thing. Even though, let's say you are diagnosed at stage 2, there is no guarantee that you will not progress until stage 5 or you will succumb to death. That's the most important thing. Secondly is nowadays we have a new phenomena with the entrance of this new variant is there are a lot of cases in which we call them as brought-in death. So yes, you suffer from very minor symptom, but then after a while, because you think that is a minor symptom, you just stay at home. However, because of this, we have cases in which some patients are being brought into the hospital after their death, and they have to be tested for COVID first. Okay, let me go back to the point. Even though you have recovered from COVID-19 infection, there are 3 consequences of COVID-19 infection. Firstly is what we call as long COVID. Okay, so we heard this about long COVID syndrome in the news. So actually it can affect anyone, even though the illness or the COVID-19 you have is mild or asymptomatic. So normally patients that have long COVID, they suffer from tiredness or fatigue, difficulty in thinking and concentration. You will have some maybe headache, loss of smell or taste, dizziness on standing. You will have a pounding heart or heart palpitation. You may have chest pain, difficulty in breathing. You will have cough, depression or anxiety, fever, and others. So this is the first consequence of COVID-19 infection. The second consequence, which is quite scary, as Prof. Maha already illustrated to you that COVID-19, the SARS-CoV-2 virus can enter through our body via the ACE2 receptor. That is why one of the long-term consequences of COVID-19 infection is called multi-organ effect of COVID-19. So multi-organ effect it will affect, if not all, almost all our body system, including heart, lung, kidney, skin, and brain function. There's a special condition that is known after the COVID-19 infection, which is called multi-system inflammatory syndrome, and also autoimmune condition. So it's been known that after COVID-19 infection, patient can experience this. And the third, which is the last one, is effect of COVID-19 treatment or hospitalization. So post-COVID-19 can induce longer-term effect of COVID-19 treatment or hospitalization. This is including post-intensive care syndrome, which refers to health effects that remain after critical illness. Okay, these are the three so-called long-term effects after you have recovered from COVID. I think we have heard in the news that some patients may have to stay in the ICU or in the hospital, let's say for longer than 1 month or 2 months, just trying to battle this disease. So the best option is, number one is try not to get COVID infection by practicing the SOP. Number two, of course, we have to try to register to get ourselves vaccinated so that we can be protected from all of these long-term side effects. I think that's all for the long-term effect of COVID-19 infection. Thank you, Hafiz.
Okay, thank you very much, Dr. Mahfuz. Okay, now so there is no at least we know, even though there is a the recovery is very high, but the severity is another concern. Yeah, my dear respected participants who joined us in this evening. There is another question, to our professor, Prof. Maha. You know, whenever I call Prof here, there will be lots of tricky questions, and then lots of questions that might, many of the people actually discuss about it and then looking for the answer. Okay, Prof. Maha, when we design vaccine, for example, or any kind of virus, we are looking into the conserved region. For information, conserved region is the region of the DNA or the RNA of the microorganism of the virus, where it is going to be static or is not going to be changed after almost all the time. Correct me if I'm wrong, Prof. Maha. So in this case, Prof. Maha, the question is, so we have mutation in COVID-19, in SARS-CoV-2, that caused COVID-19. People say that if there is a mutation, then the vaccine is not going to be effective anymore. What is your comment, Prof. Maha? Does the mutation in COVID-19 is unlikely to reduce efficacy of vaccine, or do you think it's going to affect the efficacy of the vaccine? Please, Prof. Maha.
Okay, thank you, Dr. Hafiz. The efficacy of the vaccine, we know there are mutations. It's just that mutations happen all the time in viruses particularly. And I brought up influenza because that's another virus that we are vaccinated against that mutate all the time. So we have health authorities that are out there watching the world to see which strain of virus, of influenza virus is likely to infect us, and our vaccines are then produced according to that. So the point is, even though vaccination mutation occurs, and it can affect the efficacy of our vaccine, the change at the moment, there may be slight changes to the efficacy of the vaccine, but our authority are keeping close watch of this. And we have practiced that, like I said, for influenza. We practice that there is a monitoring of these strains that are out there, and the vaccines that are produced yearly will fit to what we are seeing. So if I again may share my screen. Yeah, so an example is WHO has established a SARS-CoV-2 risk monitoring and evaluation framework to identify, monitor, and assess variants of concern. And, if there is possible change to the composition of the vaccines to protect against these variants. So there is, the changes will be made if there is a need to change the vaccines. And WHO is also working with researchers, health officers, and scientists to understand these variants. Today, researchers share their data worldwide, and you are able to access them when you do research. It's not only the researchers and the authorities, but the manufacturers also play a role in ensuring that we have the right vaccines out there. Having said that, even though there are mutations that we see out there, the current vaccines are still found to be protective and effective and safe. However, we should continue to be vaccinated with the current batch of vaccines. If there is really need to, we can then produce vaccines that are more for the new strains. We use this as boosters, right? Rather than start all over again, we can just continue to give another dose and to boost up our immune, which we do with vaccines all the time. The vaccines that we have been currently using for years and that has been protecting us for years from very serious infection and high infectivity. The reason why we have vaccines for these other viruses is because they're very infective, they can spread very fast, and then they have severe infect, just like COVID-19. None of these things are new to us. We are just experiencing it live and with the community as a large because of what we can observe, what we diagnose. We can diagnose very quickly, we can watch the spread, we can watch the mutation, which we never did with the other viruses, but we are able to do that now. But what is happening is not new. It's always been like that, just that we are getting a lot more information now. So as long as there's close monitoring and the manufacturer are, they will be cooperative to change the vaccine when it is deemed to be needed. And we use that as booster shots after our initial vaccination with the existing viruses. That's my thoughts.
Okay, thank you very much, Prof. Maha. So at least it is clear some of our curiosity on the mutation of COVID-19. Yeah. Yes, the efficacy is still there, even though if it is reduced, but it is not significant. Because when we design vaccine, we are designing it very, very clear, very thorough. It is not as simple as, I just want to take this bit and then I want to make a vaccine. No, it is. It has to undergo, various of research and study, which is actually conducted not only a few days, but few years back. Yeah, and then we have another question here, but it is for Dr. Mahfuz this time. So Dr. Mahfuz, actually we have more and more questions. I hope that if we are not able to finish here, maybe we can write out some of the answer later, right? The question, Dr. Mahfuz, why do we need to get vaccinated even after COVID-19 infection? Because we have some people who have been infected with COVID-19, positive COVID-19, and then they are now, free from, I would say that cured, okay, no more symptom, nothing else, they are, like normal, like others. And then if they already have this infection before and they cured due to following the infection without any vaccination, then should they take another vaccine? And if yes, what is your justification, Dr. Mahfuz, as an immunologist?
Okay, thank you, Hafiz, for the question. So basically, whenever your body is infected with a virus or a bacteria or any pathogen, so your immune system will work against the virus to create something that is called as immune memory. So in our immune system, we have a lot of components of immune system, but for the sake of simplification, let me just explain to you the basic in our immune system. Firstly, we have something that we call as antibody. So antibodies are being produced by B cells. And then at the same time, we have something that is called T cells. So T cell will try to directly attack the pathogen or the microbe. So in the case of COVID-19 infection or COVID-19 disease, there have been reports all around the world that after you have been infected or what you call it, you got COVID-19, not 100% of people will develop antibody, as Prof. Maha mentioned just now. So seroconverted mean that maybe 10% of the patient will not develop antibody towards COVID-19. So the reason why we don't know yet, but there is what you call it a strong possibility that you might be one of them. In the meantime as well, having said that, a similar proportion of people will also not have like T cell response toward COVID-19 after the infection. So to what you call it, to protect these people from being reinfected again, that is why people that have been with COVID-19 are strongly advised to take the vaccine after, I think, 90 days or 3 months in our country. So after you have get, let's say you've got COVID-19, after 3 months, you can take the vaccine. Number one is because when you take the COVID-19 vaccine, Prof. Maha just now showed to us this S protein, right? So S protein is very important in vaccine, especially in Pfizer vaccine and also the Sinovac vaccine. So S protein is very, the term is called immunogenic. So means that our T cell and B cell can easily recognize this protein and also create immune response towards this. And when our cell create immune response towards this, we will have memory towards this this protein. So when you do vaccine, we have this something called specific immune response. And also it has been shown in various studies as well that even though after you get COVID-19, you still have to take the vaccine because it will increase your antibody concentration significantly. In some people, you will get an increase about 2 to 3-fold of antibodies produced in COVID-19 former COVID-19 patient that get this vaccination. So actually, vaccine is very important because it can produce specific and also memory immune response. That is why we are very encouraged, or I would say, in our case in Malaysia, I would strongly suggest all adults over the age of 18 years old to take the vaccine. Just now, to prepare for this forum, I briefly looked at the census data for 2020, and the Malaysian population aged from 0 to 14, that's already about 20%. So actually, in Malaysia, for all adults, to get herd immunity, we need to get 80% vaccinated. So to do this, I think all of us, adult, age 18 and above, we must register ourselves to take this COVID-19 vaccine and also attend the appointments. That's the most important thing as well. So this is why it's very important to take the COVID-19 vaccine, even though we already previously got the infection before this. Thank you, Hafiz.
Okay, thank you very much, Dr. Mahfuz. So we have 6 more minutes, and we have many more questions. Okay, here I have another question to Prof. Maha. Okay, we know.
Sorry, maybe we now answer the question on the chat ke audience punya.
Okay, I can read one by one the question in the chat. But your question here, the one that you provide, is very important as well. You know, like, okay, this is last question for Prof. Maha, and then we'll have more questions later if there is sometimes. So sorry everyone. Okay, last week, yeah, we just received what I call we read in the articles. They have been spread everywhere. saying that kucing, cat can spread COVID-19, and then it makes lots of people scared to have cats at home. Now, Prof, can you tell me, can COVID-19 pass to pets and eventually to us? Please, Prof. Maha.
All right. Okay. Just want to share. Kemana lah? Of course, there's a tricky question. There are a few data that shows that there is that the cats and dogs are infected. Okay, before we go on to that, we know that SARS-CoV-2 is a zoonotic virus, means that it originated from animals, and it's actually from bats. The close genetic similarity between bats, COVID virus, and ours is so high that it's high likelihood that's where it originates from. But we don't get it directly from bats. Typically, it goes to an intermediate host. As you see from MERS, very clearly it went through a camel, and MERS-CoV. In SARS-CoV, it went through the civet, and Nipah virus went gone through the swine. And so it's expected that the SARS-CoV-2 also went through another intermediate host, and we are not clear which one. There are studies that says that the intermediate host for SARS-CoV-2 is not likely birds, snakes, palm, civet, pangolin, or livestock. What is likely is a rodent, and particularly a squirrel. So that is not confirmed. But there is this intermediate host that we are all looking out for. There are other studies by Shi et al. 2020 shows that SARS-CoV-2 replicates poorly in dogs, pigs, chicken, and ducks, but ferrets and cats are permissive to infection. So cats can be infected by SARS-CoV-2, but can it pass to the human? That's another question we are asking, right? So, okay. So this is just another diagram to show the same thing. So the question was, can it pass through? There is levels of hosts from animals before it comes to the human. These levels of passage is what makes it very infective, because in these animals, they don't really cause diseases in the animals. They are in there, they change in a way that they are able to survive, their host is able to survive, and when they are able to pass it to us, it is very infective. So we have learned through history that we do have to be careful. It's not about not having cats and dogs, but my conclusion of this is, if you are infected with COVID-19, SARS-CoV-2, and you have COVID-19, you should stay away from your cats and dogs and your livestock and the wildlife. Just stay away from them if you are infected. Otherwise, it's fine to have them.
Okay, thank you very much, Prof. Maha. So at least we know that we can still have cats and dogs and livestock, but if you're sick, then please stay at home. I mean, get just a little bit. Sometimes your own time to stay in somewhere that you are not close to the cats and dogs and other livestock. Okay, thank you very much, Prof. Maha and Dr. Mahfuz. I would like to request maybe 15 more minutes from both of you. Is that okay? Because we have lots and lots of questions here. Prof. Maha, okay, so let me proceed there. Okay, ladies and gentlemen, I have another question. This one is for Dr. Mahfuz. Okay, there is a dissemination of information regarding the halal state of the vaccines. Halal. Okay, how do we help in reassuring those concerned regarding the halalness or not of the vaccine? Yes, Dr. Mahfuz, if you would like to answer the question.
Yes, Hafiz, I think from the very beginning, I think there was a forum conducted by Jakim. If I'm not mistaken, it was in December last year or January this year. And I can't remember the name of the body, but the consensus of the fatwa is that the vaccine is halal. And then it is what you call it, compulsory for those who have been asked by the Ministry of Health to take it. So that is number one, from the recognition from our religious bodies. Number two is when we scroll down or we look for like religious figures all over the world, we can see that almost all of them are in support of taking COVID-19 vaccine. In fact, if you think about this, I think the government of Saudi is now mandating COVID-19 vaccine for those who have been selected to perform pilgrimage or Hajj this year. So that is, I think, in itself is a recognition that this vaccine is halal and is permissible to be used. And then we have seen also on social media, like the what you call it, the grand imam of the what you call it, the mosque, the Mecca mosque and then Medina mosque. We have seen this, that they are taking vaccine as well. Why would they take vaccine if they think it's haram or it's not permissible? So I think it's not just the Malaysian authority, religious authority that is allowing this, but all religious authority all over the world. I think they are promoting this.
Thank you very much, Dr. Mahfuz. Today I was the khatib for the Jumaah prayer at IIUM Mosque, University Islam Antara Malaysia. Part of me is the ustaz, and another part is the scientist. Anyway, in the khutbah as well, there is a mention by the what they call the Jabatan Agama Negeri Pahang, where it is permissible. But Prof. Maha, I have another question, Prof. Maha. Yeah, this is from the audience. This is not the one that has given from you. This is not the one you give to me earlier. I would like to compress all the questions into one. Okay, Prof. Maha. Now we know the authorities, particularly the Islamic Religious Council, they say that it is permissible. Okay, permissible meaning that harus. That is not a compulsory, that as if it's a wajib on all of us. Yeah. In that matter, Prof. Maha, if we look into one of the question, one vaccine in Malaysia is Sinovac, okay, which only recently gotten WHO approval but Malaysia already bought and administered to the population upfront much earlier in Malaysia. Is Malaysia not guided by WHO? What do you think, Prof. Maha, if we have any answer for this? If we don't have the authority to answer, then we will have to find what they call the right authority to explain us for such questions. Prof. Maha.
Yeah, Dr. Hafiz, saya didn't get your question. Yang Sinovac yang kita dapat tu, what was the problem again?
Okay, I read back the question. One vaccine in Malaysia, which is Sinovac, which only recently gotten WHO approval. They just got the approval from WHO. This is what the question. And then the Malaysian government, we bought it earlier before this approval was given by the WHO. So now the question is, are we guided by WHO or what do you think?
We are guided by WHO. Most our decision, our medical decision, as far as I know, is always referred to WHO. Where is it said that Sinovac only got approval now?
Yeah, so I think now the problem is we have to find out the source, okay? Whether the correct source. Yeah. Oh, yeah, Dr. Mahfuz.
Let me just add to that question. Okay. Number one, when we talk about vaccine, WHO has put a standard. I'm not sure this is applicable to all COVID-19 or all vaccine. The vaccine has to have efficacy of 50% or more In the case of Sinovac, we know already that the efficacy is more than 50%. And in fact, in Indonesia, the efficacy is more than 90%. This is the original efficacy data was probably around 60 or 70%. That was from clinical trial, but the real life data is more than 90%. That is number one. We have to know that the WHO it set a guidance, but then the approval of this vaccine, it depends on our National Pharmaceutical Regulatory Agency as well. So it's called NPRA. And then when we heard comments coming from the Minister of Science coordinating the vaccination, Yang Berhormat YBKJ, he said that NPRA has one of the most stringent criteria for drug approval in the world. So I think we have to have a bit of faith in our NPRA because they are trying to do the best job to get the best vaccine, to approve the best vaccine. And another thing that we have to understand as well is whenever we want to make this purchase of vaccine, in the whole world now, we are racing to get all of this vaccine. Sometimes what happens is there's this national, global collaboration called COVAX, in which countries are committing some monies so that all the vaccine candidates that look promising will be will be given to countries. So in retrospect, our government has to take quick action, because even though, let's say, the vaccine has not been approved yet, but in the phase 2 or phase 3, if the data looks promising, we have to quickly buy it because we want to secure the access. This is another important aspect we have to remember. In the world, we have 7 billion people, and everybody is racing to get the vaccine. So sometimes you just have to take the book it first, and then go through our NPRA so that it's safe and is effective. And then maybe after that, even though the WHO just approved it now, like recently, after our NPRA approval, I think we have to put a bit of faith in our NPRA or our health system that our government is trying to do the best to secure the vaccine and the most effective one. That's all my comment on that.
Okay, thank you very much, Dr. Mahfuz. Yes, I just received a WhatsApp saying that the Sinovac vaccine just been approved by WHO. I know it's a bit controversial here, but anyway, we believe, as me, myself, and other members of the immunologists, we also believe that the decision has that they made the best decision for the Malaysians. So in this case, we might think that we put the trust on the people of the who has been working a lot on it. But anyway, let us do some judgment on that particular thing. But anyway, as a microbiologist, as an immunologist, we really encourage, especially to everyone, to think about and then to have this vaccination. Okay, if there is if you don't have any problems on it, right? Okay. Now I have another question in regards to the same matter, Prof. Maha. Some of us before this, everyone have, like me myself, I have flu. Now I'm free, whenever I have flu or cough, I become afraid because I don't know whether this flu or cough is actually from COVID or not. Because before COVID-19, I get cough almost whenever I stress and I cough. Now because of COVID-19, I no more cough because I'm afraid if I'm coughing, then I can something say that Hafiz actually got COVID-19. Anyway, Prof, maybe if you can advise us, what is the difference between the cough because of the COVID, or the flu because of the COVID, or fever because of the COVID, and other ordinary cough, flu, and fever? Please advise us, Prof.
Okay. I'm surprised that people are getting cough and cold because we are wearing masks all the time. actually I have reduced number of colds and cough since, you know, this COVID thing started. But of course, yeah, you do go on to get it. There are distinctive symptoms. Of course, firstly, you want to know whether you have contact. You have had contact with anybody who is known to have COVID-19. So though in the early days, we could do that. But now it's gone into the community, it's quite difficult to know whether you had contact. But the first thing, of course, is to find out whether you had contact. If you have contact, then there is a likelihood that it may be COVID-19. But if nowadays it is not possible to make that assessment because, you know, you have asymptomatic one, nobody knows that they are carrying it. But there are distinctive symptoms in COVID-19, like losing the sense of smell and taste, that dry cough and all that, that you know, indicates that it could be COVID-19. I think people do get aware, do feel that they can distinguish whether it is a normal cough and cold or it is something more serious and different. But you can get tested now. There are free testing available, and you should go and get tested if you are seriously thinking that it is COVID-19.
Okay, I think that is a very good advice. Yeah, if you know that you have a contact with a positive individual, you know, or maybe you know, you have a very severe, you cannot smell, you know, when you smell, you want to eat anything, you didn't feel it, you know, you feel something wrong, and then I think it would be great if you go and get some you know, tests in that particular matter. But if you think you have nothing, you just stay at home day and night, you just eat, and then suddenly you cough, maybe you have to think twice. Okay, because I really also sometimes afraid about it, you know, like having cough, because it is very normal when I am stressed and then I will cough. I have lots of burden, a job here and there, and then mashallah I will be coughing. But alhamdulillah, now it's better. Maybe because of this COVID-19, it's actually something that is good for me as well. No more cough. Anyway, Prof, Dr. Mahfuz, I have another question for you, Dr. Mahfuz. Here, Dr. Mahfuz. All right. Okay. You know, there are lots of when you listen to people in the newspapers and everywhere, people sharing. Okay, those who are being you know, having a heart attack, you know, after having a COVID-19 vaccine, and then they pass away due to the heart attack. So now I would like to ask you: is it safe for you know, people with heart disease to take the vaccine? What do you think, Dr. Mahfuz, or maybe Prof. Bahar, you want to add it later? Let's start with Dr. Mahfuz first.
I think for Malaysia, I think the guide that has been given so far is people under the age of 18 cannot take vaccine. Number two is people who are pregnant, I think within certain weeks of pregnancy, cannot take Pfizer vaccine. Other than these two categories, and one more thing is people who experience severe allergy or anaphylaxis before this. Other than these three people, or people with these three within these three categories, they are strongly advised to take the vaccine. And another important matter that maybe we forget is that when you go to register for the vaccination, you go to all this PPV, Pusat Pemberian Vaksin, there will be, I think, a health assessment. And I think I have seen a lot of people shared in their social media that their grandfather, their father, their mother have all sorts of comorbidities, diabetes, hypertension, heart problem, and most of them, even after second dose or first dose of vaccination, they are doing fine. So I think most importantly is don't be afraid. And whenever they are doing the health assessment, make sure that you tell them you have, if you have any chronic disease, just tell them, be truth with them. This is the most important thing. I think that's all from me.
Okay, be truthful. Just mention if you have any problems, any any related disease, comorbidity, psoriasis, severe, whatever it is. Just tell them, and then let them do the need thing. And then I think Prof Maha, you angguk there. Maybe you want to add something, Prof Maha?
Yeah, Dr. Hafiz, I was just going to add that, you know, phase 2 vaccination is meant for those with comorbidities, including those who had heart disease. The only reason you are not allowed is, I mean, Dr. Mahfuz have really said that if it is uncontrolled, say for example, hypertension is uncontrolled, you know, then you have to see your doctor. Basically, you have to see your doctor to get a certification that you can take the vaccine. But phase 2 is meant for those who have comorbidities. Unless you are, that your doctors will only stop you if your disease is uncontrolled. You know, you're taking your medication and it's still, you're having symptoms and all that. Otherwise, diagnosed with the condition is not a prevention to take the vaccine.
Okay. Thank you very much, Prof Maha. Okay, I think I have one more question to Dr. Mahfuz. Okay, Dr. Mahfuz, when you look into the cases of COVID-19, those who have passed away, okay, you can see that many of them, you know, it's not when they are reporting on the people who have passed away, most of them are very at the, you know, very old age. You know, some of them it already has a heart disease and many other types of diseases like cancer and many more. You know, like and whenever KKM reported on these people, they said that these people have passed away due to COVID-19. All right. And then as if like other types of diseases no longer exist. So people are no longer die because of, you know, because their age is very old and they are dying because of the old age. You know, these are some of the comments and the critics from many of, you know, people around there. Maybe if you have any idea how to convince on this matter, yeah, what do you think, Dr. Mahfuz?
Are you referring to like this broad in-depth case, or are you referring to some other cases? I don't really get what you mean.
Okay, I'm referring to the cases in Malaysia. You know, when we look into the data release, or the people who are actually die because of, they said it's dying because of the COVID, but it's actually COVID with you know, heart attack, COVID with, you know, certain types of comorbidity and other types of diseases, and then COVID, and then these people is already at a very old age. You know, because these are some of the questions that comes not only to me but also to almost everyone. Maybe you have you know, justification to tell to people that yes, it is really COVID, and but other types of disease is still there. What is your comment?
One thing that we have to know, I think in medical field, or like I think when you go to hospital, let's say, when a patient dies in a hospital or even at home, we have something that we call autopsy. So autopsy is being done to determine the cause of death. So when, let's say, your friends or family member pass away, you will have a note from a doctor saying that, okay, this person died because of so and so. So I think in the case of what you call it, what's happening now is, you have death because of COVID itself. That's number one. And then you die because of something else, but then you are also positive with COVID virus. So these are like two different conditions, but then again, because of the COVID situation, because it's very transmissible, so your the body cannot be handled by your family members or something like that. So it's going to be handled by special people that is wearing PPE, so on and so forth. So yes, we are convinced. I think the figures that are being published is very truthful, and I think the what you call it, mortality rate in our country is about 0.5, with 0.5% only, which shows you that our healthcare system is good, but then our healthcare system is reaching its limit now. So the best option is always try as much as possible to practice all these SOPs. and then try to, whenever you have this kind of symptom and you think that you have been in contact with someone that has COVID, make sure to quickly get yourself tested. If you couldn't wait, I know that now our healthcare system, especially the public healthcare system, we have a backlog or maybe a bit of what you call it queue to get yourself tested. If you're not sure, then maybe what you can do is you can go to the private hospitals or clinics that offers you this COVID-19 testing. You can do either the RTK testing or PCR testing to just make sure that you can stay at home at ease and not to worry about something else.
Okay, thank you very much, Dr. Mahfuz. Prof. Maha, I think if because it's already past 20 minutes from what we are supposed to end. It's supposed to be at 4 o'clock, but I think the audience is still there. We have 96 participants, and in our Facebook we have more than 50 individuals are still joining us. But because of the time, the limitation of the time. We have, I think, roughly about 10 more questions, Prof. Maha and Dr. Mahfuz, and I don't think that we are able to answer to all the questions. But perhaps I will give these questions to our respected speakers, our respected Prof. Maha and Dr. Mahfuz. If you can, we can prepare some answers to all of the the questions that's made by the audience. But anyway, Dr. Maha, Prof. Maha, if it is possible, in 3 minutes, if you can conclude from our discussion today, what on the topic on COVID-19 vaccine, separating between misconception and truth. Prof. Maha, any of your thoughts to conclude our forum in this evening?
Okay, to conclude, we have, I think the world has worked very hard towards finding a cure or treatment or prevention for COVID-19. But at the end of the day, the responsibility falls on you to prevent, because you can flatten the curve. You can by simply wearing your mask, staying away, distancing, and using hand rub or wash your hands. As they say, your vaccines may not have sufficient efficacy. The virus will mutate and the treatment become resistant. But you use alcohol, if you use more than 60% of alcohol, it'll kill the virus every time. So it's as simple as you taking the responsibility and the time to make these simple hygienic practices that we seem to never get a hang of, but maybe the world is telling us you need to start now. That's my message.
Okay, thank you very much, Prof. Maha. I think that is very clear. It is now our responsibility, I know there are a lot more questions from the audience, and maybe some of the audience might not happy with our discussion today, and some of the audience may be convinced with whatever Prof. Maha and Dr. Mahfuz has been mentioned to us. We at MySOMOI, Malaysian Society of Oral Microbiologists and Immunologists, we are trying our best to fulfill our responsibility as a scientist, as a medical doctors, as a dentist, and many, many more to explain to the audience, to the Malaysians, because we are fighting with an enemy which we cannot see, with our naked eyes. If you want to use the the microscope, is also sometimes very, very difficult. So my dear brothers and sisters, I think Dr. Mahfuz, 2 more minutes for you. If you want to conclude, you want to share anything just for the conclusion. Thank you, Dr. Mahfuz.
Okay, I think I want to give like another motivation, or like in the English term, what you call it, make you see the light at the end of the tunnel. I think when we are facing this pandemic, the things that we do is, number one is either we understand why we do it, or number two is the fear of the consequence of not doing what we're supposed to do. Like in our case, like if you are not complying with SOP, we will get fined and stuff like that, and we'll got COVID and stuff like that. I want to add another layer of that is that when we look at the countries that have gone through this pandemic and have vaccinated more than 50% of their population, we can see that some of this, restriction are being lifted and things slowly come back to normal. It's not 100% yet, but countries like Israel, countries like UK, countries like US, some of these restrictions are being slowly lifted so that people can come back to their normal life. So we have to envision that our country someday will become normal again. So just be patient, follow the SOP and vaccinate yourself. That's the most important thing.
Inshallah, from what I call the explanation by Prof. Maha and Dr. Mahfuz, I hope that if it is not 100% enlightened, at least 20%, 30%, or 10% even enough for us, at least for you to share this information, share this knowledge. We are trying our best to tell you people it is good for us and too many of us to take the vaccine. Yes, it is true there are many other concerns that we have here, like those people who are autoimmune, SLE, and many others. But due to the limitation of time, we are not able to discuss on that particular matter. But dear respected participants for this forum, all the questions that you have provided us, inshallah, we are trying our best to answer each and every of it, if that is possible, Prof. Maha and Dr. Mahfuz, so that every one of us will be happy. We are not trying to make you happy, but we are trying to fulfill our responsibility, because there is a hadith where Nabi Sallallahu Alaihi Wasallam says, "Kullukum ra'in wa kullukum mas'ulun an ra'iyati." What does it mean? Everyone is responsible, and we are responsible on our knowledge. We have the knowledge, so we have to transmit, we have to transfer to you to have the correct, the truth, the best of the knowledge that we ever that we can have and we share with you. So with that, my dear brothers and sisters, the audience, thank you very much, Prof. Maha, and future to be Prof. Mahfuz from University of Malaysia, Pahang, and Prof. Maha from University Putra Malaysia. And I would like also to thanks to the Malaysian Society of Oral Immunologists and Oral Microbiologists for the opportunity to having us today, Prof. Maha, Dr. Mahfuz, and also me, myself. And my dear colleagues, if you want to, you can share the link that I have given to you. And we are going also to upload this video in the YouTube channel, in our YouTube channel, so that you can, spread it or you can disseminate it to many others. With that, thank you very much. I would like to conclude this discussion, this forum, with the beautiful recitation of what I call Wabillahi Taufiq wal Hidayah. Assalamualaikum warahmatullahi wabarakatuh, and have a good weekend. Thank you very much. Thank you. See you again in the future. Bye-bye.
Terima kasih. Assalamualaikum.
Thank you, Hafiz.
Sama-sama.